Alex, I got to ask, what made you want to get started with this company? Did you always have a health background, or was this something that you fell into?
Yeah, so to start all the way at the beginning, I was an economics major at Arizona State University. Anyone who's an econ major knows that you're relegated to sales jobs. And so I was out there trying to get my first job, and the only company that called me back was Enterprise Rental Car, and I'm very grateful for that. But I knew that I didn't want to sell rentals, and I didn't want to work in that. I was stuck in limbo, and so I happened to be at a family friend's house for 4th of July, and he's a business owner and pretty successful. And my wife said, "Hey, you need to go talk to Michael," was his name, and just ask him for some advice, see what's out there. I had no idea what the options were. I approached him and said, "Hey, would you mind having lunch with me?" And he said, "I can do breakfast next week." And so I showed up to the breakfast, and I always like to talk about how I was like, recent college grad. I had hair down to the middle of my back. I was wearing a tie-dye shirt and shorts, and turns out it was my interview. I didn't know that. So I was made for a very kind of awkward breakfast, but that was okay. And he asked me, he said, "Have you ever thought about getting into IT?" And I said, "Like computers? No, my brother likes computers. I don't really like building computers. It's not my thing." And he goes, "Okay, well, what about software development?" And I said, "Oh, like coding, like I've tried it, not very good at it. I didn't really like it." So he goes, "Okay, how about a business analyst?" And I said, I have no clue what a business analyst does. And so he explained to me that's somebody that kind of stands in between the technology and the business side and helps both sides navigate the world and, of course, provide the data that helps the company succeed. And so I said, "Oh, that sounds interesting. Okay, that's great." So I left that interview, and again, I didn't know it was my interview. So I left that saying, okay, there's a thread for me to pull on. And turns out he actually called my dad immediately afterwards and said, "I think I want to hire your son to come in and help me build a system." He called me back and said, "Have you ever heard of Salesforce?" And I was like, "I don't want to do sales, man. I don't know what this is." And he said, "No, it's a system. And I'm using it to build an EMR from the ground up, an electronic medical record for my business. Would you like to come in and be my administrator?" And I, not having any other opportunities out there, I said, "Sure." And so I started up with Beach Medical Group and started my Salesforce journey. And that kind of transformed into Adobe Population Health. And I've been along with this company and with my mentor and also Jamie Ambrose, our current CEO, this entire time. So.
That's great. So I've got to ask, because this is like a badge of honor when you're in the Salesforce ecosystem, how many certifications do you have?
I have 5 certifications in total. So one of those rolls up into the application architect certification. I'm a boot camp kind of guy. I love going to those events. And so Trailblazer DX is like my favorite conference of the year. And I
Yeah.
always try to get a certification while I'm out there.
Nice. I love it. So you guys built the EMR, the electronic medical record system, off of Salesforce. So is that basically what houses your program that you have or that you communicate with to your members?
Our EMR is configured to run our entire business. So whether that's clinical or operations, to scheduling, to billing, we've been able to use the Salesforce platform to basically solve any challenge that happens in our business. Now, I don't like to reinvent the wheel. We don't do accounting on Salesforce. We have systems for that. We don't have HR in Salesforce, but what we do and the type of case management that we do, and we've alluded to this a little bit earlier, is that we take a different approach to case management and healthcare. And so there's not a system out there in the world that does healthcare in the way that Jamie, our CEO, imagined. And really, this EMR is built on her college thesis, on her doctorate thesis, on how case management is done. So I basically had to sit with her and figure out, take her brainchild and her idea and turn it into a system, and then also get all the downstream business processes built in as well. We have a Salesforce, a very mature org. We don't use any cloud solutions. We're not on Health Cloud. When we were coming up, Health Cloud and our EMR were being built in tandem, and we've had a great relationship with Salesforce and their health and life sciences team to building systems out. I think that Health Cloud is getting very close to where it would need to be for somebody like me to use it. But because we're doing something novel and unique, the Salesforce platform, I like to call a Lego box. I'm not starting out with pre-configured Millennium Falcon, but I can build a ship myself, is the kind of the way I like to say it.
Nice. I love it. And you guys don't just help out your customers. You guys take the time to help out your other companies as well. And because of your solutions with patient billing and care data and health insurance validation, You guys, and I quote, have saved a company more than 5,000 work hours annually and over $439,000 in total labor and efficiency value. So that is pretty impressive. And that's amazing that you were able to build the system like straight off the Salesforce platform. That is pretty incredible. So if there's something in your industry that you would like to improve on, or if there's any need that your industry have, what do you think that would be?
No, of course, the big challenge in healthcare is standardization and interoperability. We don't communicate with each other. Doctors don't know what we're doing. We don't know what they're doing. And it really makes for bad data, which ultimately makes for bad experiences for our members. Because if they aren't getting their claims put in, and let's say, for example, there's a program called risk adjustment. This is something that they need to do, members need to do on Medicare every single year to have their benefits match their needs, right? And so if we don't complete that and we don't capture that the member is diabetic or may have had an amputation every single year, then Medicare may, just because they're working with billions of lines of data, that person might slip through the cracks and not get the support, not get the medication that they need. So really, there's just mountains of data that need to be moved and need to be made sense of. And I know that there are industry standards out there that are trying to do their best. HL7, FHIR. When it comes to social determinants of health, there's groups like the Gravity Project out there that are trying to standardize these things. That's something that we really need to get down to. We can't be so rigid that everyone has to use the same system and therefore it doesn't work for anybody. But we do need to be able to communicate with each other, whether that's through health exchanges or direct integrations. And really, it's hard for the doctor's offices, let's say, for example, to have the time to implement technology. So we also need to bridge that gap too. When we go into doctor's offices and say, we have a solution for you, we'd love to implement something like our Maslow solution in your doctor's office. They say, this is really great and it could have an impact, but I don't have an extra 15 minutes. I don't have the resources to integrate this with my system. I wouldn't even know where to start. And therefore, everything just stops. So you probably have experienced the same thing. I think we all have at the doctor's offices. You go in, you sit around, nobody's in the room, the doctor comes and talks to you for 5 minutes and he leaves. That's because they're so busy and inundated with bad systems and lack of data that they just tackle the challenges right in front of them. They can't actually tackle things around them. So Adobe Population Health really tries to fill in those gaps and share data. That's really ultimately what my team, we spend most of our time just moving data around and making sure people have the right information.